Thank you so much for joining us today for our webinar on the effects of sleep on workplace health. We hope that this webinar will provide some insight and resources into how sleep impacts workplace health and employee sleep. I'm excited to introduce our speaker, John Letter. John is the president of the Sleep Charge Business Unit. John oversees business operations, customer care, growth, and diversification of the Sleep Charge business in the U.S. market. John has 30 years of executive leadership expertise in general management, sales, operations, and operating units. We'll be answering questions at the end of the presentation, so if you have any questions, feel free to type them in the question box, but please refrain from specific individual medical advice. Private information should not be provided, and we will do our best to answer as many questions as we can at the end of the webinar. And so with that being said, John, I'll let you go ahead and take it away from here.
Thank you, Jessica, and thank all of you for spending some time, taking time out of your busy schedule, and welcome to our webinar in really talking about this idea of what role sleep plays in the workplace. This is one of personal passion to me. It's what attracted me to the business, having experience leading operations within businesses and being part of accident and injury committees and reviewing healthcare costs and disability claims. Never once really thought about the impact of sleep and its role in the success of the businesses that I was part of, but in the success of business overall. So today we're going to take a little bit of a deep dive into some of the facts, some of the detail around the role that sleep plays in the workplace. So to answer our question, are your employees coming to work tired? This survey that was done by MetLife Employee Benefits Trend would tell you resoundingly yes. The question is, how are you feeling more than half the time at work? 34% of people said they're tired or stressed out. But additionally, when you look at this population, they're burned out, discouraged, distracted. When we look at, the folks that we work with us each and every day in business, we have to recognize the fact that we're not coming to work necessarily with our best selves. And we've got to really take a focus, and it's what we try to do to help our client employers and their health plan members in recognizing how important proper sleep is to their success in the workplace. We all know that good health cannot exist without proper, healthy sleep. It's an essential part, as I tell people all the time, it's a biological imperative. It's like water and food and shelter. It is essential for us to exist, and without good sleep, we can't truly attain great health. Statistically, 1 in 3 of us experiences a sleep disruption on any given night. Anywhere from 5 to 30% of us have a sleep condition, underlying sleep condition, a sleep disorder, or sleep disruption that's driving that. And interestingly, most recently, there was a meta-analysis of about 44 different studies from around the world during the COVID time that said that the number of people experiencing sleep disruption in the past year is up to 40% of the population. The other thing that we know is that people that people often suffer from multiple sleep conditions currently. For instance, people that wake up and say, I have trouble getting back to sleep. Once I wake up, my mind races and I can't get back to sleep. I start going. Well, when you peel it back and look at the root cause, at times that insomnia, if you will, can be symptomatic of that condition that is causing you to wake up. Say sleep apnea or restlessness that's causing you to wake up, and then your mind gets going. So it's It's very complex and people deal with multiple conditions. Lastly, we know there is a direct correlation link between sleep disorders and chronic disease. In particular, things like hypertension, diabetes, coronary artery disease, and the like. And we also know that those that are afflicted with these types of chronic conditions and sleep disorders have a significant cost multiplier to our average population. It starts at 1.5 times the average population. We've seen it as high as 3.5 times or amount of your average employee member healthcare costs annually. Thank you, Jessica. Also, we know that sleep affects you not just physically, but emotionally, mentally, behaviorally. And when we look at it, like when we think about the impact of poor sleep and you look across the spectrum at the bottom, even one night of poor sleep helps to create this emotional dysregulation. We've all dealt with this. Any of us that have had a child that have dealt with those sleepless nights know what it's like from an emotional standpoint, from a cognitive impairment standpoint. But over time, as people have continued to poor sleep, they exhibit more and more conditions related to that poor sleep, things like anxiety and depression. Just two statistics for you. Sleep problems affect over 50% of those with generalized anxiety disorder. And 65 to 90% of those with depression experience sleep problems. So from a behavioral standpoint, the more you move to the right of the spectrum, the more impact it has on your behavioral health and then ultimately your physical health. And when you look at your physical health, obviously it affects immunity first and foremost. If our body is not resting and repairing itself and preparing for the next day, you're not at your best self, as I had mentioned earlier. Your immunity is compromised. We all know logically that if you're not attentive and you're fatigued or deprived, safety becomes a larger risk for you. And then, as I had mentioned earlier, comorbid conditions. We know from the data from our clients, from real claims data, that 30 to 70% of people that exhibit a chronic comorbid condition, like diabetes or hypertension or coronary artery disease, also have an accompanying sleep disorder. So these are folks that over time, as they become more deprived, become less healthy. So what does this mean for you, the employer, we, the employers? Behaviorally, on the left side, as we talked about earlier, an increased chance as you move across that spectrum, an increased chance of human error at work. We've done a lot of studies with clients, One Six Sigma, that talk specifically about error rates when people are more fatigued. You have a tendency to make poor decisions, or it's tougher to make the right decisions. And we know that behaviorally, you're not on your game, so to speak. Your productivity declines. Physically, over time, that manifests itself for the employee or the member and the company in higher claims costs. As I had mentioned earlier, the 1.5 time multiple. It also leads to attendance issues. Significantly more sick days. And in a couple studies, 242% more sick days annually for those with a treated or untreated or a condition that's been diagnosed that hasn't been treated related to their sleep. We also know that they're 2.2 times more likely to take extended disability leave, which is all impacting our bottom line. Now, what are sleep deprived individuals? And I think this is one that as I had mentioned earlier, that we can all grapple with, having been sleep deprived at any given time. The first bullet point about being less able to detect nonverbal cues, I think, is particularly important given the environment that we've lived in over the last year. The ability to interact with people over video conferencing and understanding the impact of what you said or haven't said, that ability to understand verbal cues is even more important now. And if you're sleep deprived, you have less of a chance of catching that. We're also less likely to act. We're more likely to react to a situation more emotionally. It's tougher for us to give and take criticism or direction, or even what's most important for business, from my perspective, is the ability to collaborate with people in a way that you can come to conclusions and solutions. We're also less able to solve problems creatively. It's something that happens, that proverbial brain fog, that doesn't allow you to sort of creatively think through problems that also are very important each and every day in business. And then lastly, as managers, as leaders of people, that gives us the inability, or at least makes it tougher for us to manage and develop others. If you think about collaboration and communication and understanding, encoding and decoding communication, it makes it tougher when we ourselves are sleep deprived to be able to lead and manage others. Sleep deprivation also decreases our concentration levels. We know in particular that when we're fatigued, it's hard to stay focused on things. We're more easily distracted, right, by not being able to focus, which really takes time away from critical thinking, problem solving skills, and the like that we had mentioned earlier. But even, and this statistic is scary, but anyone that's seen someone in a car that looks down at their smart device, their phone, for a quick second, let alone even more, just think about how quickly a distraction can double the likelihood of errors. But we also know if we're getting enough sleep, and the sleep that we're getting is quality sleep that's benefiting us, it's going to at least limit not only the fatigue, but the chances that we have as it relates to our health, our safety, and risk in business. How about safety in the workplace? The relationship between sleepiness and workplace safety, accidents and injuries. Excuse me. Sleepy workers are 70% more likely to be involved in accidents. One study that I always like to bring people to is a study that was done in 2000 about sleeplessness or sleep deprivation and its relation to what would be considered a blood alcohol level content, or a BAC. And that study said that over 18 hours of wakefulness, so being awake for 18 hours, has the same impact on one's concentration, coordination, and reaction time as a 0.05% blood alcohol level. And someone that's been awake for 24 hours straight has a 0.10 BAC equivalent, effectively meaning that they're legally intoxicated from it as it relates to reaction time, as it relates to coordination. These things increase risk dramatically. We also know that workers with chronic insomnia are more likely than those that are well rested to have industrial accidents and injuries. So it's very important to understand that safety in the workplace is that good sleep is a key to proper safety in the workplace. Poor sleep and activity. Physical and cognitive reaction times, without question. The fact of the matter is that, we slow down, as I just mentioned in the previous slide. The 3 seconds doubles the increase of risk of injury in the workplace is important. But this also contributes to significant real productivity losses. Statistically, almost $2,000 per employee per year related to poor sleep productivity losses. 1.23 million lost workdays annually. And statistically, when you're sleep deprived, your productivity decreases by at least 50%. So imagine a workforce that's working at half steam when they've reported to us that over half of the time at work, at least 34% of people are saying they're exhausted. Certainly, good sleep can help you manage chronic conditions, right? As we talked about earlier. We had mentioned that insufficient sleep is linked to chronic disease, but it's very, very important to what we call your DTQ. That are type 2 diabetics to be able to improve and lower their blood sugar levels. It's really about your duration, and that is how long you're sleeping. Are you getting your 8 hours? The CDC will tell you 7 and 9 hours of sleep per night. Our chief medical officer would tell you the same. But it's also the consistency of your schedule, what we call timing, or what's called in sleep medicine timing. So it's how long am I sleeping? Am I doing it consistently? 7 days a week, and then the last, which is the Q, which is the quality. Am I getting the right quality when I'm working to be in bed asleep for 8 hours a day at the same time each night? We also know, and this is a pretty cool one, and not from a scientific view, but there are a couple hormones that are produced in balance when you controls hunger. These hormones are not produced in the right balance if we're not getting the right sleep. So as I tell people, anyone that has had maybe a little bit too much to drink in a night before and wakes up with that sort of I need a greasy burger, if you will, very much is related to the fact that alcohol has a huge impact on proper sleep. It allows you, or does not allow you in this case, to get the necessary quality of sleep, even if you've been in bed for those 9 hours. And it's a very real sort of thing that it's tough to exercise. It's tough to eat right. We need to do whatever we can to make sure that we can stay in the best balance possible, so that our immune system, and that's the last thing that I want to hit on in this slide, especially given what we've dealt with over the past year with COVID-19. A study came out that was done recently, well, in 2020, of 2,900 healthcare workers and immunity. And they were talking about sort of the buildup having to deal with COVID patients on a consistent basis. And they found that those that were sleep deprived, those healthcare workers that were sleep deprived, 2.6 times more likely to be infected with COVID than their counterparts that had proper sleep. And that COVID was more likely to be severe in those cases. So immunity, the ability to get the proper sleep to build up our immunity, is essential in order to help fight disease. Now, we're going to go through a couple of examples of, in our program, some of the things that we measure, but really importantly, what it means to that person, that individual, that participant, that patient, and then what it means to their company, the employer. We know that properly controlling and intervening with people, allows them over time, as you could see, this is a client of ours since 2016, related to those folks that have diabetes, hypertension, hyperlipidemia, and or coronary artery disease. So that group of folks in a matched cohort versus the folks that have one or more of these conditions that are in the sleep charge program. And as I was once told, you don't necessarily bend the curve because people get older from 2016 to 2020, but being able to connect, find the root cause, get to the bottom of it, use clinical, medical, behavioral, and human support to help people on their journey allows people to be healthier and cost less. On the right is the trend of the cohort over that time period versus those that have been properly treated within the sleep charge program. Now we'll take a little deeper dive and look at diabetes. Same type of cohorting that we provide annually with clients. Again, the blue bar being the sleep charge participants and being able to intervene in what happens to people over time versus their twin, if you will, with diabetes in the marketplace. Diabetes is something that blood sugar we had mentioned earlier. It's like hypertension. It's one of those things, type 2 diabetes, that can be controlled with proper diet, weight, exercise, and proper sleep. So this is an impact of sleep's contribution. It's not sleep alone, but sleep's contribution to helping people that are dealing with diabetes to have a fighting chance. And then hypertension. And again, I love the science as it relates to this. There was a study that was done, a paper that was published 3 years ago, I believe it was, that said, and I think it was from the American College of Physicians and Surgeons, but I am not positive. We can find that out. But I was thinking about it as I was preparing this, that hypertensive, someone with hypertension, that also has an accompanying sleep disorder that has not been treated effectively, the hypertension medication is ineffective. So as part of a workup for someone that's hypertensive, you have to be able to determine whether or not they have a sleep problem. And what happens physiologically at night is that when you're getting proper sleep, your body is relaxing, your blood pressure is decreasing during sleep stages, and it's allowing your body to repair. When you have these interruptions, things like sleep apnea that cause a fight or flight response and cause you to wake up, your blood pressure doesn't have the ability to sort of regulate and lower and prepare yourself for the next day. So it's logical to us, but it's extremely important in the fight, particularly for high blood pressure, to ensure that proper sleep is a part of the regimen of managing blood pressure. Let's talk about, why does this happen? There are so many people, statistically, 80% of people with a sleep disorder go untreated. Well, from our perspective and our discussions with not only our patients, our participants, but with our clients and in the marketplace, is that there's a lack of awareness that exists about the importance of sleep in managing my hypertension or diabetes or my coronary artery disease. So awareness is a huge obstacle to care. Also, they're not treating those, or sort of leaving them unresolved, if you will. It's missed opportunities to prevent, to get ahead of things, to live a healthy lifestyle from a preventive standpoint. And if you're not aware, or you don't have access to care, or the way the care is delivered to you, and you have a sleep problem, you're missing an opportunity as an individual or as a company sponsoring those individuals to provide preventive solutions for people as it relates to their whole person well-being. We also know that in the world of sleep healthcare in particular, that solutions are very limited. Access to the right specialists in the right places. Some people may have to drive 300 miles to get to a sleep specialist. So bringing things to people virtually in their homes, bringing access to a patient that's having a problem, meeting them where they are is extremely important to ensuring that you can get ahead of and resolve issues that may exist. And then lastly, like some things in healthcare, particularly in sleep medical and behavioral healthcare, is that systems are disjointed. A primary care physician may not be involved necessarily unless they're really proactive in someone's sleep care and how they're doing and what they're doing. That's where we come in, what we do to sort of help make those connections so that people can get the proper sleep necessary, and we bring the solutions to them so that it's not limited, it's not accessed, limited access, it's not unresolved, it's not unaware. So these are at least some of the obstacles to sleep care. And then lastly, the proverbial drink your milk. The CDC would recommend that workplace health programs that improve sleep are a good thing. Interventions can, as I had mentioned, they can benefit employee health, well-being, thereby reducing on-the-job and off-the-job safety and risk concerns, and helping to produce or boost productivity. It also helps, whether directly or indirectly, as I mentioned, with hypertension, for example, in managing the risk of not only having a condition, but conceivably of developing that condition. If it's a precursor, and sleep is one of those causal factors to chronic health conditions. So, Jessica?
Yes, John. Thank you so much for all of that information. If anyone has any questions, feel free to please email us at sleepcharge@knoxhealth.com or visit our website, sleepcharge.com. We are so excited we got to present this information to you, and we want to thank you for taking time out of your busy days to learn more about sleep and how it impacts workplace health. This webinar will be sent out to you via email later this week or next week, so feel free to share it with your colleagues, coworkers, and as I said, if you have any questions, feel free to reach out to us. We'd be happy to talk with you. Thank you, everyone, and we hope you have a great day.
Take care. Thank you all.